neurosurgery residency program at the University of Florida has a long tradition of excellence.
We are very fortunate at the University of Florida to have a very diverse faculty from institutions all over the country.
The faculty are exceptionally well, known in the sort of academic neurosurgery nationwide and even worldwide.
In terms of epilepsy or tumor, we're in clinical trials. We've got very advanced endovascular devices. We're always in development of these things. Our spine program is wonderful.
I mean, there's not many places you go where it seems like all of the faculty are the world expert in whatever they do.
We do close to 4,000 cases a year. We take 3 residents a year, so we're one of the larger neurosurgery residencies in the country.
We all feel strongly that we're here to help educate residents.
What surprised me the most was actually how approachable a lot of the attendings were.
The door is always open, it seems like, whenever I have an issue or want to talk about something.
We do a skills lab where you learn about suturing and how to do procedures.
We did it as part of a transition to intern week that you do before you start here.
And these include things like subarachnoid hemorrhage in the ED, brain tumors that are actively herniating, and what do you do when you encounter these patients?
We have some simulators about things like lumbar puncture and pedicle screws.
You can really see what you're doing in terms of where you're placing your screws.
I got to do the ventriculostomy simulator before I started residency here.
Getting to do that, knowing that that might be something I have to do very early on, was definitely comforting.
My first week here, when I had to do a ventriculostomy on a patient, I actually felt very comfortable with the procedure.
Anything that can be simulated, we've simulated here.
You can take patients with complex intracranial problems, fuse their scan to the simulator, and practice doing EVDs with midline shifts.
The program is dedicated to understanding each resident, what they like to do, making sure they are exposed to everything, and then coming up with an individualized plan for that resident to succeed in the goals that they want, especially during the research time.
And so one of those things is allowing residents to leave this institution and go to other institutions around the country.
It allowed me to leave the university here and actually go to Chicago and work with Dr. Julian Bales in doing both basic science and clinical research in traumatic brain injury.
I did it in New York. It was amazing. I was able to study what I wanted to study. The department supported me wholeheartedly.
The idea is that we want you, when you're finished, to get to the goals that you've set for yourself.
Every day in conference they're being asked questions, they're being asked to verbally explain how they're thinking about a certain problem and what they're going to do about it.
And especially the pre-op conferences essentially are in an oral boards format.
The more you're exposed to that kind of environment, the better, and I think more comfortable you're going to feel during the actual oral board exam.
Each year, those residents who've already passed the written board for credit take a mock oral board that's given by our faculty, and it really gives the residents an opportunity to see what's expected of them.
I think residents should expect to work really hard and have a lot of fun. And I think that ultimately it's a rigorous training program which will allow them to come out after their 7 years of training to be excellent surgeons, to be competent researchers, and to be compassionate physicians, and also to understand what it takes to avoid physician burnout and to have long, successful careers.